Hello, and welcome to the Post COVID-19 Interdisciplinary Clinical Care Network Education Series. This video is the second part of the series on mental health and COVID-19. As always, please remember that these educational modules do not replace a visit with your family doctor or other healthcare provider. Remember to take your time to watch these modules. Aim to limit your screen time by watching just a little bit at a time. You are welcome to pause or to look at any videos as many times as you wish or need. Before we begin, we'd like to acknowledge that PHSA provides services to a diverse population, including First Nations, Inuit, and Métis peoples living in various settings and communities across BC. As a provincial network, we operate on the unceded traditional and ancestral lands of many Indigenous peoples. We wish to acknowledge with respect and gratitude all of the Indigenous nations, Inuit, and Métis communities with whom we live, work, and provide care. We risk falling into low mood or depressive thinking when we have a health condition or have gone through a traumatic event such as a critical illness that limits our ability to do things we need or love to do. Feeling down at times is part of life, and most people deal with this at some point. No, you are not alone. In this module, we're going to talk about low mood and depressive thinking. You will learn how to recognize and cope with both, and how, when, and where to get help. We will also provide some helpful resources to help you in your recovery. Low mood can sometimes last for days or weeks. Here are some of the typical signs. Feeling sad or tearful a lot of the time. Feeling numb or empty without a purpose. You may find that activities and hobbies you once found interesting may no longer be enjoyable. Feeling irritable is common and can lead to becoming easily agitated and intolerant of others. Falling asleep may become a struggle for you, or you may have trouble staying asleep or getting out of bed in the morning. You may not have a desire to eat or may overeat in response to how you're feeling. Finally, low mood, much like recovery from illness, can lead to having very little energy for tasks or concern for self-care or appearance. It is especially important to know that having low mood does not mean you are weak. You do not need to be ashamed of it. It is common when dealing with the overwhelming stress of a serious or life-changing illness or loss. Thinking of low mood in this way can lead to feeling worse. So what can we do? It is helpful to focus on things you can change. Use your precious time and energy to help yourself feel better. After having COVID-19, people often find it difficult to keep up with routines or activities that they used to do. Low mood can add to this. Even if you are unable to do all of your normal activities, it is helpful to maintain as normal a routine as possible, one that includes goals that you can meet. You may not be able to work during your recovery, but some goals that may be attainable are to get up at a regular time, wash up for the day, and put clothes on. Perhaps plan one short outing per day and work up to more if your symptoms allow you to do so while remaining within your energy envelope. Remember to always follow the guidance of your doctors and healthcare professionals. If activity tends to make your symptoms worse, please consult your doctor. Isolation can make us feel worse. Reaching out to others takes energy. This can be hard, but can be very helpful for low mood. Even if you don't feel like socializing, staying connected with people you trust and activities that you enjoy helps to keep you engaged, to pass the time, and to boost mood. Even if you have one person who you can connect and check in with, this goes on. This goes a very long way. Doing so can expose you to activities that help you to feel better. You can also do this by choosing activities that help you to relax your mind and body. Take a bath, put on music that you find relaxing, do a breathing exercise, or any activity that would normally bring you pleasure. Think of other ways of coping than turning to alcohol or drugs. Eat well and get enough rest. You might look completely well outside, but many symptoms after COVID-19 illness are invisible. Get support if needed from your family and friends for preparing healthy meals, continuing regular mealtime routines, and taking care of necessary tasks. Try to remain involved even if you are unable to do the task yourself. Because we know that how we think and behave affects how we feel, we know that moving our bodies is helpful to combat low mood. Stay as active as your body will tolerate and try to spend time in nature when you can. Nature outings can help with being active, connecting with others, and relieving stress. Talk to the people you trust and share your feelings. While you may find it exhausting to carry out long conversations and digest information, especially if the content is problem focused, it can help to keep these conversations going. But keep them to a limited time frame. Set a time limit of 10 to 15 minutes and make efforts to also ask your audience about their day and how they're doing. Helping others in even small ways by running an errand, extending a kind gesture, or listening to their concerns can really lighten mood. If you have spare time, consider volunteering as a way of finding purpose and meaning. There are many options for volunteering even if you are not fully mobile or recovered. Some people even find it helpful to share their own experience with others who are struggling during recovery. Focus also on any positive experiences, observations, or thoughts from your day that you are grateful for. Write these down or share these with others. Research tells us these activities, no matter how small, help to put you on a positive path to feeling and coping better. When we look at the cycle of depressive thinking, we see that depressive thinking includes negative or inaccurate thoughts about your condition, yourself, or your future. This kind of thinking actually feeds depression by triggering negative emotions and impacting our behaviors. For example, when we're feeling sad or frustrated, we tend to be less active and less motivated to care for ourselves. We are more likely to isolate ourselves by withdrawing from those that care for us. We also know that our thinking can lead to stressful situations that can result in misunderstandings and conflict with others around you. These experiences can lead us to think and feel worse. We know that staying in this cycle can really affect your outlook on life and how you deal with your health condition. So, what can we do about depressive thinking? One strategy is to challenge depressive thinking by replacing it with more realistic thinking. Thoughts are not facts. They are not necessarily accurate or true. Even so, our thoughts can still powerfully impact the way we feel and behave. It is common when we're feeling badly to think or expect the worst, to focus on the past, times we may have failed, and any losses we may have experienced. This can also lead us to avoid certain activities or people, which can worsen low mood. To counter this, it is important to balance the positive and negative aspects of a situation and to work to see things as they are, as accurately as possible. Try to counter any what if thoughts by evaluating what is the true likelihood that something bad will happen. Perhaps consider if something unplanned or undesired happens, what strategies might you use to cope? Much like avoidance, depressive thinking becomes an automatic and vicious cycle. In order to change it, we need to move beyond the familiar place we are in and practice a new way of thinking. Making this change takes time. One of the most effective ways to change to realistic thinking is to pay attention to your thinking in a stressful situation and to consider other points of view. For example, ask yourself, how would you interpret a similar situation if it involved a friend or a family member? How would you respond to them? Would you be negative and harsh or be more hopeful and supportive? Be intentional and plan your practice of realistic thinking. It will not happen automatically. Seek feedback from others you trust. Explore examples and the evidence for alternative, more useful ways of thinking. Write them down and refer back to these coping thoughts when you need to. Keep adding to the list as you go. Use these examples to talk back to your depressive thinking and to challenge it. Doing this can help to make depressive thinking smaller and less powerful. For example, thoughts such as, I can ask for help if I need to, I'm stronger than I think I am, I have overcome tough things before, this will pass, if I put this off, I will just feel worse, I just need to do it, it's okay if it isn't perfect, this may be uncomfortable, but it won't last forever. I will be okay. These type of hopeful messages can help to motivate you to continue to move forward. Feeling overwhelmed can cause us to act without thinking, so it is very helpful to be ready with a tool that can help. Use this stop technique to prevent yourself from reacting and saying or doing something you may later regret. Practice so this skill becomes automatic when and where you need it. Let's practice together right now. Stop. S is for stop. Stop what you're doing and pause for a moment. Don't move. Stay in control. Perhaps adjust your posture. T is for take a deep breath. Take note of your breathing. Is it fast or are you perhaps holding your breath? Take a break. Perhaps take a step away from the situation. Then observe. Notice your thoughts, feelings, and any urges that are present. Notice what others around you are saying and doing. After taking things in, the final step is to proceed mindfully. You have a choice in what happens next. Think about what will help make the situation better. Consider what behavior would be best in the moment. Perhaps walking away, perhaps staying quiet. Not acting is sometimes the best choice. As with any new skill, practice is extremely helpful in learning the technique and having it ready in the moments when you need it. Perhaps try to imagine a stressful situation to practice with, or use it a few times in a situation that is a little more controlled when you have more awareness and ability to change or modify your behavior. Some final thoughts. It takes time and repetition to set new patterns of realistic thinking. This is a daily practice and starts with small steps. Like a pair of well worn shoes, eventually the new thoughts will begin to feel more comfortable and true to you as well. So, how do you know when to seek further help? Depression can lead to significant suffering, and we want to ensure that no one suffers in silence. It is important to recognize that being at risk for significant depression has warning signs. You may notice that significant changes in your physical symptoms, behaviors, emotions, or routines occur daily, are more severe or last for 2 weeks or more. When you feel empty or you don't find joy in things you used to. You were avoiding people or activities that used to be a big or important part of your life. You stop caring for yourself or others around you in the same way. Those closest to you are likely to notice these changes, perhaps before you do, and share their concerns. These are some of the signs that you need help. Remember, you are not alone. If this is your experience or you feel alone and uncertain of what to do, reach out and talk to someone. This may feel hard to be vulnerable and to ask for help. That is a normal part of healing. Much like a muscle that has not been used for some time, it will get easier. For many people, there is a place for medication and counseling in helping to treat depression. This is okay. Healthcare providers can assess and direct you to the help you need. Talk to your family doctor, a counselor, or contact a crisis line. If you are feeling that life is not worth living, or you are self harming or considering suicide, get help immediately. Call your doctor, go to the emergency department, or call 911. Know there are also crisis lines available 24 hours a day, 7 days a week, and toll free if you need someone to talk to. Here are a number of options listed below. The staff on these lines will listen and will not judge you. They will offer guidance and resources to help you through your crisis. It can be difficult to know how to help someone who is struggling with low mood or depression. Here are some ways for family and friends to help. Know that people who are dealing with depression can be unwilling or unable to ask for help. They may need your practical and emotional support. It's important to act if you are concerned about someone close to you. Reach out and stay connected with them. Practical support, like helping to make appointments, driving or going with them to an appointment, helping to look after their children, doing meal prep or home tasks can help. Emotional support can include phoning or texting regularly to see how they are doing, perhaps nightly, making a regular or perhaps weekly visit for a check in, a time to have tea, coffee, or to do an activity you both enjoy. Be ready to just listen and encourage. Your support can really help your loved one to seek help, continue with their treatment plan, and make progress. Educate yourself. Know the warning signs we discussed earlier and how to talk about depression as well as where to get help. Ensure you have support for yourself as you help others through their difficulties. It is important to remember whether you are living with low mood or helping someone through it, you are resilient. Don't underestimate your ability to cope. Remind yourself when you have faced tough things in the past, how did you get through it? Who did you lean on and what was helpful to you? Be kind to yourself and each other. Learning and trying new coping skills takes time. If you miss a day, it is okay. You are still moving forward and can always begin again. So now is the time to reflect and to think about next steps. Which of the strategies we discussed will you try? Will you set a routine for your day? Use some coping statements to talk back to your depressive thoughts? Call someone to talk or check in? Try an outing or relaxation exercise? Perhaps try the stop technique when you are in distress. Or perhaps try a gratitude practice. Will you reach out to someone in your life you are concerned about to offer support? Once you've chosen, it helps to write it down. Put it up somewhere where you can see it every day. Make a promise to yourself to do it for even 1 hour per week. Add other strategies as you go. There is no right to do this. Just start and take one step at a time. We would like to leave you with this short meditation exercise that you can do anywhere. When you're ready, take some time to click the link in the description and enjoy. Thank you for joining us today and for investing in your mental health and well being. Please take some time when you are rested to explore and consider these other resources.